Hello, I'm Jonathan Nelson with the Texas Academy of Family Physicians, and this is your Capitol Report. It took the full 140-day regular session, plus an extra 30-day special session, but the 82nd Texas Legislature is over. The task of crafting the state budget dominated the regular session as lawmakers confronted an estimated $27 billion shortfall. The final budget for the next 2 years spends $172.3 billion in state and federal funds, about $15 billion less than in the current biennium. While Health and Human Services sustained the largest reduction, almost $11.3 billion, physicians' rates for Medicaid and CHIP were not cut. Lawmakers did not account for a projected caseload growth in Medicaid, leading to speculation that the program will run out of money sometime in the spring of 2013. Amid the cuts to higher education is the loss of about $39.8 million for a set of programs designed to recruit and train primary care physicians. Lawmakers eliminated funding for the primary care preceptorship program, along with 2 lines of funding supporting primary care residencies. They cut the new physician education loan repayment program by 76%, a move that will affect access to care for an estimated 1.1 million Texans in underserved communities. And lastly, lawmakers slashed support for family medicine residency programs by almost 74%. Altogether, these cuts represent a withdrawal of almost 80% of the state's investment in the production of its primary care physician workforce. Dana Sprudy is the residency program director at the UT Southwestern Austin Family Medicine Program. She says these cuts are tragically short-sighted.
At a time when our nation and our state need more primary care physicians to, rather than not support and grow those and meet the healthcare needs of Texans, we've actually decimated that educational funding. So I think it's a tragic turn of events.
Since 2002, total support for primary care residency training has been cut from $51.7 million to just $5.6 million for the next biennium. And this latest round of cuts will undoubtedly reduce the number of training positions available.
I guess really the bottom line now is spend a little money now in graduate medical education and get primary care physicians in your community, or spend a whole lot more money later on trying to patch the myriad of medical horrors that your community will face not having access to primary care.
One bill passed by the legislature will help keep a set of Texas-trained physicians in state after completing residency. House Bill 1380 by Representative Vicki Truitt of Keller and Senator Jose Rodriguez of El Paso allows international medical graduates to receive a medical license after 2 years of residency training instead of 3, making it easier for them to begin working right out of residency. The governor signed the bill into law in June. Family medicine won several other victories during the legislative session, helping to pass a number of public health initiatives and thwarting efforts by nurse practitioners seeking independent diagnosis and prescriptive authority. You can read about these and more in the summer edition of Texas Family Physician and online at TAFP.org. Late in the special session, the legislature passed an omnibus health reform bill that aims to make the delivery of health care in Texas more efficient and better coordinated. For more on that, here's TAFP's Kate Alfano.
Early in the session, lawmakers began crafting measures that used innovative market-based ideas to encourage better coordination of care in hopes of increasing quality and reducing costs. In the special session, these bills were rolled into the Omnibus Health Reform Bill, Senate Bill 7 by Senator Jane Nelson of Flower Mound and Representative John Zerwas of Fulshear. Proponents believe the bill will save about $470 million in Medicaid and CHIP over the next 2 years by expanding Medicaid managed care into South Texas and creating incentives for doctors and hospitals to integrate their clinical data by forming healthcare collaboratives. One of only a few physicians serving in the legislature, Representative Zerwas says that by changing the way we pay for services in Medicaid and in the private market, we can develop a healthcare system based on quality and efficiency.
These are all, I think, things that we all have heard a lot about. Some of that is in the Healthcare Reform Act that we saw come out of Washington a couple years ago. But none of them have per se really been tested out there. And so these parts of the bills create opportunities for physicians, healthcare systems overall to work together to try to promote quality and efficiency.
TAFP supported these reforms throughout the process, but the loss of state support for graduate medical education may hamper their chances of success. Moving forward, Representative Zerwas says that physician involvement in the legislative process is crucial so that lawmakers understand the complexity of the healthcare delivery system.
You know, a lot of times physicians wonder, is it really making a difference for me to come up here and spend time with the legislator and talk to them about that? And I have to say, it makes a huge amount of difference. And the way to probably enhance that effectiveness is to get to know that person in the interim even more. Involve yourself in discussions that they may have. Certainly in the campaign process, involve yourself in their campaign to get reelected, which, as we all know, involves money and time in terms of getting those people back into office. But those are things that really, really do make a difference.
Thank you to all of our physician advocates in the 82nd Legislature, especially our key contacts and our physicians of the day. For TAFP News, I'm Kate Alfano.
Perhaps the hottest topic in healthcare these days is payment reform. How can we align payment and other incentives to reward good health outcomes, better quality, and cost efficiency? And just as importantly, how will these changes affect you, your patients, and your practice? To help you prepare, TAFP is hosting a one-day Payment Reform Summit on October 1st in Austin. Some of the state's and the nation's foremost experts will be on hand to discuss what's on the horizon for the practice of medicine. For information and to register, go to tafp.org. We hope to see you there. The legislature may be over for now, but TAFP's advocacy on your behalf continues. Connect with your colleagues and join in the discussion on TAFP's blog, txfamilydocs.org. Find us on Facebook and follow us on Twitter. For more in-depth coverage of these and other issues important to the family physicians of Texas, check out the news update block on TAFP's homepage, www.tafp.org. Thank you for watching TAFP's Capitol Report. I'm Jonathan Nelson. We'll see you next time.